Recovering from knee surgery is highly variable.
It was going to take forever to get better if I was ever going to get better.
There's got to be something out there besides a CPM machine, which clearly isn't helping me.
Active and aggressive with this thing, or I was going to need
I'm a guy that's not looking to relieve the pain. I'm a guy that's looking to get back in the game.
That downtime was not what I wanted.
We've spent the last 7 years perfecting the recovery system that takes variability out of knee rehab, so you can quickly get back to your life.
Welcome to The Bee's Knees, a podcast full of articles, interviews, clinical studies, and advice about knee surgery, physical therapy, and life after knee surgery.
Hi, this is PJ, host of The Bee's Knees, our podcast on knee surgery recovery. If you're listening to this on Facebook or on YouTube, don't forget to check your favorite podcast source, because you can subscribe to The Bee's Knees at any time and get updates as they're created. We're trying to get a podcast out every week or so, sometimes more than once a week. In this episode, we have a terrific interview between Mary Elliott and 70-year-old yoga teacher Kathy Reddington, who lives in Michigan. Kathy did both knees at once, a bilateral knee surgery and recovery with Dr. McCardal in Michigan, and she tells all about the decisions to go forward with two knees at once, as well as how she chose her recovery path and how she did after 3 to 4 weeks getting back to her life after, again, both knees at once. She found the X10 for her recovery through a friend who had written a paper about the machine and the amazing recovery that people get from using the X10. So I thought that was kind of interesting. Let's listen to Mary Elliott interview Kathy Reddington about bilateral knee surgery and recovery.
Hello, this is Mary Elliott, and I am speaking on behalf of X10, the X10 Recovery System. And today we're going to be talking to Kathy, who has just recently had bilateral knee surgery. So she's going to share her experience with us. So that way, if you're contemplating having bilateral surgery, you can learn from Kathy, from her wisdom of what she just experienced, and have a successful recovery yourself. And also, you may want to pay attention to what made her, arrive at the decision to have bilateral surgery. And based on her decision, is she happy with the course that she took, and why, and what advice she has for you moving forward so that you can make a very healthy, great decision about your upcoming knee surgery and recovery also. All right. Hi, Kathy.
Hi, Mary.
Can you go ahead and start by just letting us get to know you a little bit? Tell me a little bit, about you. Share who you are. And
well, I have to go back a little bit. I'm going to be 70 this year, so this is like monumental for me. And I've always been very active. I was a martial artist for 20 years, and I competed nationally for 20 years. I teach yoga now. I'm into the easier, softer. But about between 12 and 15 years ago, I just stepped out of a car and I blew out my left knee. And I had a scope, which was fairly successful. And they said to me, well, you'll eventually need another knee, but not now. And my left knee it started to bother me. When I would walk, I used to walk my dog like 5 miles every morning, and I felt like I was bending down anytime I had left on that knee. And towards the end, I was walking 2 miles and a half mile. And then my dog passed away. Then I stopped walking. But I kept up with my yoga, and it hurt. There were postures I couldn't get into. There's a lot of knee action that I could not do. And I was kind of just making my way through that way, still not admitting that I was going to have knee surgery. And last October, I stepped out of my car again, and my right knee blew out in the same manner. So then I had 2 bad knees. And I went to 3 different doctors, orthopedic surgeons, interviewed them all, saw what they recommended for me. I was on crutches from the point that I stepped out of my car the second time and had the surgery. I was on crutches mid-October through the surgery date because I did not have a leg to stand on. Both of them were bad. So the doctor that I did finally select, Dr. McCardal here in Lansing, was just amazing. And I knew he was my doctor from the very beginning. And I inquired about bilateral knee surgery. Could I get them done at the same time? Why would I want to go through that twice and take that kind of rehab time and basically use up 2 years in rehabilitation rather than 1? And he said, yes, I consider it with you, because I was practicing my yoga and teaching yoga right up until the day before surgery. And he agreed to do it. And I knew that, it was going to be an undertaking, but I was emotionally ready, mentally ready to do it and to do it well. So
wow.
Bilateral was like a forced choice almost for me. If I did one, I'd still be on crutches or a walker or something. So, and which one to do first, it just didn't make any sense to me.
You said when you met Dr. McCardal, you knew he was a surgeon for you. How did you know that? Like, what made you decide that?
Because he was willing to give me as much time as I needed and explain everything in great detail, answer all my questions. He was personable, his bedside manner. He was just, and his brother is a friend of mine. And everybody I talked to that has had knee surgery, his name came up probably 75% of the time. And I asked him how many bilaterals he had done. He said hundreds. And he said, but I've done thousands of single knee replacements. And one of my friends that I work with, real estate broker, had bilateral surgery a year ago by Dr. McCardal, and he was raving about him. So all the recommendations, and there was a connection. I just trusted him. I trusted him to operate. And I believed what he said, and so far, everything he said was right on. He didn't try to candy coat it, sugarcoat it. He was right up front with it. And I love that. I love to hear the real story, not, something that's not quite, tell me what I need to hear, not what I want to hear, And that's what he did.
That's comforting, even to just hear you say that. So I can only imagine what it did for you. Now, okay, so you made a decision on what surgeon. You made a decision, yes, I'm going to have bilateral surgery. This is the right answer for me. Now, how do you decide upon recovery? Did you know what your options were? How did you move from, okay, I've made the decision to have surgery, now how am I going to handle my recovery?
I didn't know anything about the X10, but fortunately a friend of mine had worked with an orthopedic surgeon and done a research paper. And his research paper was on the X10 machine. And when he heard I was going to have the bilateral surgery, he said, oh, Kathy, you need the X10. And I said, talk to me. And he told me about it, sent me the link. And I read everything and listened to all of the blogs and everything that everyone had to say. And I thought, I want recovery time less. I want to recover as quickly as possible. And why wouldn't I want this machine? My insurance didn't cover it, so I paid out of pocket. It was worth it to me to make that expenditure, and I haven't looked back since. The day they brought it, I was thrilled. It was the weekend before my surgery. I had a chance to play with it a little bit, so to speak, so that I was familiar with it. And boy, when I started on the X10, I went 3 times a day religiously every single day.
Wow, with both legs you went 3 times a day?
Yes, yeah. It comes with 2 chairs, one on each side, one for the right, one for the left. So I do a half hour right, half hour left, 3 times a day, and then I'd ice after. Those first 3 weeks when I was home, it took up all my time. That's all I was doing. Between my physical therapist that was coming to the home and my X10, I worked on my recovery 24/7 pretty much.
I can imagine. I would expect that. I would expect your life to be like that, especially with bilateral.
Yeah. And I was ready to do that. I made the commitment before I went in. I'm going to put everything into this. And so I was ready. I was just ready. I prepared myself.
Okay, let me ask you this. So, all right, so now you made a decision all on your own on what tool you were going to use for your recovery. Your surgeon didn't recommend the X10. You had a friend that recommended it to you. What happened when you discuss that with your surgeon? Hey, I found this I found out this information about this machine. What transpired between you and him in regards to your recovery choice?
Well, when I mentioned that, he said, I don't have direct experience with it, but I have a patient who used the X10, and he had a wonderful, time between, a shorter recovery time. And he said, I wouldn't be opposed to you using it if you've done the research, if you're comfortable with it. And we talked about insurance coverage. And, I said, mine's not covered, but I'm willing to pay for it anyway. But he said, I think great. Everything you can do for your recovery, to enhance your recovery, to make the time shorter, to make, to get to that point where you need to get to and to help you stay there. Do it. If you're willing, he said, then I can tell you're a fighter and I can tell you you'll use it. You'll benefit from it. So I would support that, he said. And that was all I needed.
Okay.
So,
And let me ask you this, Kathy. Someone out there who's contemplating, boy, should I have bilateral or not, because I need both my knees done. What kind of support did you have? So you had a great surgeon, great recovery tool, but what would you advise them that they should put on their checklist so that way moving forward they can move forward confidently, successfully, peacefully? What would you recommend?
I would recommend letting go of all expectations of what it's going to look like and committing to 4 weeks of, pretty concentrated recovery. I would recommend the X10, no questions asked. I would recommend it to a single or a double replacement. It was phenomenal for me. Moves your leg without any pain, without any stress, and it moves you gently. So I would say if you need bilateral, why go through 2 surgeries? Why put the body through 2 surgeries? Why put the body through 2 recoveries? If you're confident with your surgeon and they feel that you could do it and do the recovery, do it.
Well, let me ask you this. Explain to me what a day looked like in recovery, like from morning till night. What was your day like?
Okay. I would get up in the morning. And, at first I was sleeping on the main floor, but once I could do the stairs, I was able to go upstairs. But when I first got home from the hospital, I was sleeping in the bedroom downstairs. And I would just get up, stretch a little bit, do some heel pumps, and then try to, with my walker, navigate to get some water, get some coffee, bring those things to the X10 machine. I had a little table by it. And then I'd sit down and watch the news and do a half hour on each side before I did anything. And then I'd ice for a little bit and then go make some breakfast. And the next thing I know, I'd try to get dressed, and it was time to go back on the X10 again. But I tried to do it, based around the meal times, always after dinner. And then, sometimes I'd be a little more stiff. Like if I had physical therapy and I felt a little more stiff, I would just go on it for 5 minutes on each side just to get the range of motion moving. And it was just, it was a wonderful tool. I felt like my buddy had left when they picked it up. So, yeah, my recovery buddy.
All right. Well, let me ask you another question. Okay, so I see what your day looks like. I can picture it. What kept you motivated to keep doing this?
Well, pain's a great motivator. And, the more that you move it, the pain does lessen. And the more that you get that range of motion, the sooner that you can get to a reasonable range of motion, the less pain you're going to have later. And that was a motivating factor for me. Do the work. It might not be easy right now, and I kept increasing the angle. And at the end, the last 4 days, I was at 0 at the extension, and at the flexion, I was at 130.
Oh, God. And I looked at your milestones. I mean, you did tremendously well. 15 days post-surgery, I have down that you're at 0 and 105 range of motion, right? How did you feel about that? That must have been quite exciting. I can imagine. And then I have 19 days post-surgery, you were walking without a cane, and you were able to go up and down the stairs. Am I understanding that correctly?
Yeah, 2.5 weeks, 19 days. Yes, I was doing, yes. And I was going up and down the stairs, and then by the 25th day, I was only holding on to one railing and going up the stairs and down the stairs on my own, pretty much with just one railing, doing one step at a time going up.
Wow.
And, yes, it hurt, but I'm a very determined person. When I set my mind to something, look out. And this is something I wanted my life back. The surgery, I was motivated to get the surgery because I wanted my life back. I could no longer walk. I could no longer bike. Yoga was down to a minimum. Sometimes I didn't practice. I just taught because I had pain. And so that's been my motivator. And, I've seen the results happen. And just because I was walking didn't mean I was, at first I thought, I'm walking, I'm fine. I'm going to be fine. 4 weeks, I'll be back to normal. And that was the education part for me, because I learned that, no, you won't be. And you'll have days with pain, and you'll probably have a lot of days with pain, and it might last for months. And my doctor finally said, up to a year, you'll be back 100%, but 6 months you're going to feel great. And I really thought that, since I'm walking so quickly, it's going to be different for me. And, it's not. And that was a lot. But the X10 was there with me, holding my hand through the whole thing. And I just had to trust the process. I had to let go of my expectations and trust the process. And it's a whole lot easier when you trust the process. And let me tell anybody that's out there, if you use the X10, if you make the decision to use the X10, that process is very trustworthy.
Thank you, Kathy. I appreciate that. All right. So tell me this. So you had a great experience. What now? So now you have a strong foundation. You achieve these great results. How do you maintain them? What's your game plan now?
Dr. McCardal has written a prescription for 4 more weeks of outpatient therapy. So I'm going to outpatient therapy 3 times a week, and I have a stationary bike downstairs that I ride every day. And okay. I would love to get back to yoga as soon as I can. However, I don't want to push it. I don't want to go backwards in this recovery. So I've learned to be smart. I've learned a lot of lessons. I'm one of these type A personalities, let me get to the front of the line, and I've backed off on that. So this has taught me some things, some good life skills, things that I needed to learn anyway.
That's fantastic.
Yeah.
That's fantastic. All right, so anything else that maybe I haven't asked you that you would love to share with somebody who's contemplating having bilateral surgery?
Wow. I would say, what are you waiting for? Get on with your life. Get the surgery done. Get on with the recovery and live your life full. You don't need to skip the activities that you love. You don't need to, use a cane all the time. There's a solution.
That's beautiful. You know what? I've always taught this to my children too. The hardest thing is sitting on the bench, watching others do the things that you want to do. So you're already doing the hardest thing, right? So any action you take to progress you towards your dream is going to be easier than what you're currently doing, because sitting down watching other people have what you want but don't have, that's suffering, right? That's suffering. But living life to the fullest, right? Seeing you progress, and you know inside of you that you're taking action to move you forward, that's beautiful. That's empowering. Right, and that brings you peace, right? Yeah, absolutely. Beautiful, right? Beautiful. Kathy, you are such a good soul. I am so glad that our lives touched one another. And thank you for your time here today. Thank you for including the X10 in your recovery. And I am so happy to see you doing so well. And, if you need anything ever in the future, we are still here for you, always here for you.
Thanks, Mary. I appreciate that. Can I add one thing?
Yes,
absolutely. That I didn't mention, and this is mentioned in the X10 that you get a recovery coach. And I had Melissa, Lisa, I had Mary, and then there was also John, who brought my machine over. And those recovery coaches, sometimes I'd hear from 3 of them within one day. How are you doing? I saw how you did today. Congratulations. And if it hadn't been for that human element, telling me, hey, you're doing great, we all need that encouragement. And someone on the outside couldn't do that, but the recovery coaching component that you have is a very important piece to mention because you have support. You may be home alone doing this, but there is support. All you have to do is pick up the phone if you need it, and they'll call you even if you don't need it. So I wanted to mention that. It's very important.
That is important. I'm so glad you brought that up. So was the machine itself easy to use? You had your coach for support, right, and to let you know when and what to do when. But, okay. So you had both. So you had the machine was easy to use, but yet you had support from all of us. And we do that purposely because we do want to help you get, the recovery you're desiring, that you're looking for. So we care. Just like you, we care, and we want you to do well. So that's great. Thank you for mentioning that. I can't believe I didn't ask you that. Thank you. Thank you for bringing that up. Thank you, Kathy. All right. Anything else you can think of that I might have not asked you about?
No. I think
we're good.
Covered it pretty much. Yeah.
All right. Well, thank you, everyone, for listening. I hope we brought peace and clarity into your decision making. And, Kathy and I and everyone here at X10 wishes you a healthy, living a life to the fullest, right? Having your dreams come true for yourself. Thank you so much. Thank you, Kathy.
You're welcome, Mary.
I'm Dr. Justin Trosclair, host of 2-time Podcast Awards nominated A Doctor's Perspective podcast. I interview doctors in and out of my profession about their specialties and the occasional non-doctor special guests. But we also go behind the curtain and see what's working for their marketing, overcoming struggles, practical knowledge, book choices, and relationship advice. Join me on any podcast app on your phone or visit adoctorsperspective.net for the show notes pages and free resources. I want you to have an abundant home life as well as a thriving practice. So come on, take a listen.
To learn more, visit x10therapy.com, 1-855-910-5633. Just a reminder, it's a huge help if you subscribe to, rate, and review our podcast. It helps people find us.
X10, back to full strength.